Well, I wish the reform would have gone more seriously after correcting fee-for-service medicine, because we know that drives patients and providers to do things they necessarily maybe shouldn't do. I mean, there have been studies showing how much extra radiation people have gotten because they've gotten more CAT scans than were needed. And hopefully, if you're in a strong environment, in a strong clinic, you can begin practicing frugal medicine without being concerned you're going to get sued because you're doing it.
That's where the solution for the healthcare problem lies, right there.
I think anytime you take an issue as complex as the American healthcare delivery system and its costs and all that, and have essentially people outside of our industry mapping out what change has to happen, that we get this kind of result. I mean, change had to occur because what we're doing can't sustain itself, and basically everybody inside the system believes that, even though we'd like not to have some change in certain cases. But it seems to me that we've kind of turned this over, not purposefully, but we've turned this over to people outside of our industry to design the reform because we, from an enlightened self-interest, didn't do it ourselves. And we got ourselves into this consequence. So there's a consequence for everything we do, some positive, some negative. I think that some corrections that will go on will be very helpful. But I think as industry representatives, we need to understand the intention of healthcare reform, what part of it is going to be helpful to the patient, what part of it isn't, and point those things out and help correct it. But we've essentially created a circumstance, I think, that has allowed people outside of our industry to totally redesign the way the American people are going to be thinking about us. And we've done it because this system doesn't work as well as it ought to.
We clearly need doctors and hospital people to step up and suggest ways we can do what we're going to do better. And we really need it this time. Optimistic but realistic leadership. If we all get in a funk and make our employees and physicians feel that this is going to be awful, we're not going to be providing very good care.
Right.
And it's going to be different, but it does not need to be awful.
We do need to be upbeat. We do need to be positive and provide that leadership. We can't, as you say, let our employees, let our doctors get into a funk. There's something that's good that's going to come out of this. Only if we allow ourselves to lead our way through it.